they're usually coming to me because they already know that they have a problem. They can see it in their visual quality's gone down, they're having more problems driving, things like that. So one is that they're scared of cost. Two is that they're just scared of the actual procedure. So I usually try to address those two things with them because that's usually would be the reasons why they don't do it. And so fear of the surgery is a real thing. For me, having done tens of thousands of surgeries, I know it's going to go really well. For them, it's their first experience and it's their eyes, which are precious to everybody. And of course, we understand that. Cataract surgery overall is extremely safe, especially in the hands of experienced surgeons. And we do thousands per year. There would just literally be no way we could do that volume if we were running into problems consistently. It's extremely rare to have a problem with cataract surgery. The vast majority of patients are very satisfied, high patient satisfaction, very low complication rates. It's probably one of the safest surgeries you can have, and the results are almost immediate. And people very quickly after they have their first surgery and they realize they just get over that initial fear, and they move on to their second eye. Usually they just can't wait to get the second one done because they sort of understand what's going on at that point. But it's a completely natural thing. We definitely address that. I usually let them know that, hey, we're going to give you some sedation during your procedure. We're going to make you comfortable. I also just like to chit chat with them, just establish a little rapport. One thing they're a little bit surprised to hear is that I'm going to be awake during surgery, and that freaks them out. And we say, yeah, but you're not going to see me coming at you with like my instruments. It's not going to be scary. You're not going to be gripping the rails of it's just gonna look like a little kaleidoscope light show, and we'll have a little conversation, or sometimes we just listen to some music, and it's over in about 10 minutes. So the whole thing is about 10 minutes. We don't use any stitches. We don't use any, we're not making needles. You're not gonna feel needles. You're not gonna feel any stitching or anything like that. So it's a comfortable procedure. There's no pain involved. It's just the idea of getting over, oh my gosh, someone's going to be operating on my eye, which we get them through.